Welcome to MissPoppins, The Art of Parenting, podcast dedicated to creating a supportive community for new parents. Welcome, Kristen. So glad to have you on our episode today.
Thank you so much for having me.
Let's get started right away. Why don't we start with exploring the challenges and strategies for breastfeeding mothers dealing with common infant food allergies? We get that question quite a bit.
Yes, we certainly do, as in my dietetic practice. One of the most common that I do see is cow's milk protein allergy, or CMPA. It actually affects 2 to 7.5% of babies worldwide. So it's pretty prevalent. Some of those first common symptoms that we do see is that frequent spit up, constipation. We might see bloody stools. Atopic dermatitis or eczema is a super common one that we see with it. And also wheezing, just shortness of breath and just not able to breathe as well. So of course with that, some of the challenges a breastfeeding mother might feel is guilt. They might feel that their milk is not quite good enough or nutrition enough. They might feel like it's their fault for causing their baby's discomfort. And it can be extremely discouraging for mom. Another common challenge that we see is just not knowing if it's actually the breast milk that's causing these issues or if it's something environmental, like a viral infection or just like environmental allergies, an illness, something like that. However, if we do suspect it is the cow's milk protein allergy, we do want to encourage moms to continue breastfeeding. No matter what, their breast milk remains a valuable source of nutrition and is so comforting for the baby. So some of the strategies to alleviate some of these symptoms would be an elimination diet, which in itself is challenging. And, we kind of monitor for signs of improvement with that. There's specific protocols that we can follow, but it's, it takes a lot of time and a lot of effort to go ahead and go through this elimination diet. And so if that is the case, if a mom is going through, an elimination diet, they might find it challenging for themselves to find foods to consume and keep her diet as balanced and nutritious as possible. So this common challenge arises for mothers. Sorry, okay, we might have to cut this. I just lost my train of thought.
That's okay.
Okay. So one of these common challenges that arise in maintaining a balanced and nutritious diet for themselves is this elimination diet, which often involves cutting out specific foods that may be those potential allergens. So this leaves mothers at risk for nutrition deficiencies, not only for them, but for their babies as well. So it is crucial during this time for mothers to incorporate alternative sources of nutrients. So for example, we can incorporate more or different types of fruits and veggies, different whole grains, and we certainly want to include a calcium fortified alternative. In some other circumstances, we do need extra supplementation, such as calcium or vitamin D.
Okay, and then how do we envision if all of that is not working, right? Of course, breast is best is what we hear, and moms are trying everything under the sun, but it's something that is not working for the baby. They have chosen the formula route. Is there any sense into how they can choose that appropriately? What nutritional needs and health factors they should consider? Let's take a deep dive into how to choose the formula, since we've talked about breastfeeding a little bit as well.
Yeah, absolutely. So, with the formulas out there are a ton. It is an absolute huge market. Whether a mom is breastfeeding or not, I typically recommend to start with your basic cow's milk based formula, whether that's a term formula or a preterm formula. Those preterm formulas do have special nutrients in them for the preterm baby, such as higher amounts of protein and calcium and phosphorus for bone development. So we start with that. If we see, some symptoms, or if we see some reflux symptoms or some colicky, fussiness symptoms with that, our first line of treatment might be to try a different formula, still one that's cow's milk based, but we might try a spit up formula that has added rice starch to it. It's a pretty, low risk, alternative to cutting out dairy altogether. An example of that would be Enfamil AR. We also have some lactose or reduced lactose formulas such as Gentlease or any of those labeled sensitive formulas. A new recent one that has been coming out a lot is goat's milk formula. It has recently been approved by the American Academy of Pediatrics over here in the States. So that's pretty new and super popular right now. However, it's not suitable for that cow's milk protein allergy because those proteins are so similar. And then going into, like, if we do have a confirmed allergy, we might want to try a partially hydrolyzed formula. So this still contains the cow's milk proteins, but they've been partially hydrolyzed or broken down. So it's much easier to digest. And some of those popular ones on the market are Nutramigen, Aliment. Yeah, those are the two most popular ones. And also Gerber Extensive HA, that's another one. So those are like the partially hydrolyzed ones. And then if we do have even like severe allergies or malabsorption, still having bloody stools, then we do what's called an extensively hydrolyzed formula or an amino acid based formula. So these ones are completely hypoallergenic. The formula or the proteins are completely broken down into that amino acid form. So super easy to digest, super easy to absorb. And that's pretty much like the most medically like indicated formula on the market. And a lot of times you do need a prescription for those. And that would be like your Elecare formula, your Pyramine or Alcamino formula.
Interesting. And we also hear quite a bit between the distinction of European brands versus American, right? Most of the ones that you mentioned, are they more American based? Is there a distinction in someone choosing Holly, for example? I used to hear about that a lot. That's European based versus something from made in America. Can we talk about that a little bit?
Yeah. So one of the things that the FDA does look at is the nutrients in the formula that they're allowed to produce and sell on the shelves. So all formula in the United States, it must have iron added to it. Not all formulas do. So some of those, like, out of country formulas, they might not have iron. And we know, iron is such an important nutrient for newborns, and especially as they get a little bit older and their iron stores start to deplete. And they also are required to have 30 nutrients that your baby needs. So they're all fortified, where some of these European, Australian formulas, they might not have the same fortification standards that America does.
Got it. Okay, so something to obviously be always aware of when picking formulas in distinction. Gosh, didn't know that there was that many options. So of course, consult with your pediatrician before choosing the appropriate one and making the decision. We talked about something interesting in the beginning, right? We talked about the concept of spit up and allergies. So I want to go back to that as well. It's so scary. Of course, with babies, it's spit up. With toddlers, it's that reflex when they're eating. But right now we're focusing on babies. So help us understand why babies spit up, and then how can parents differentiate between normal behavior and potential health concerns?
Yeah, absolutely. So, we of course hear of babies spitting up, happy spitters, all of that. But there is a common physiological sign of why babies spit up. And usually it's not a concern, but it is because of their immune digestive tract or digestive system. So that lower esophageal sphincter, which is what separates the esophagus from the stomach, it's not fully developed. So it's much easier for the stomach contents to come back up. So, with that, it's typically not a concern. Some other non-physiological signs of spit up that also aren't much of a concern is, if you're lying down right after a feed, if you're moving around too much, such as, putting down, getting down for tummy time right after a feed, if we're feeding too quickly, or if the baby consumes too much milk in that feeding, it could just, be too much for the stomach to handle at that time, and again, come back up as spit up. So those are the concerning signs. But if we are seeing that more like projectile, that forceful spit up, you hear it's like going across the room, it's shot out, it's, coming out of their nose, they're irritable. We see like the back arching a lot, distended abdomen. Sometimes this leads to poor weight gain. Constipation is another one that goes hand in hand. These are all some of those concerning signs. So something that we'd want to dive into a little bit deeper, probably address this with the pediatrician. And that could include, like what we mentioned before, it could be an allergy to a food, it could be cow's milk, it could be something else. It also could be something more serious, such as pyloric stenosis, and which that's where, if we see like that curdled acidic milk coming up. So those would obviously have to be addressed by a pediatrician and probably some other specialists on board.
Of course, this all sounds, it's kind of related to digestive health. So let's switch over to digestion and understanding our infants' gut health a little bit, right? Gut is so important. What do you consider are the key factors that a mom should know is affecting a baby's digestive health, and how can parents support infants' gut health from birth?
Yeah, I'm so glad you asked. Gut health, pediatric gut health is my specialty. It's my area of expertise. So I'm so glad you asked that. But it actually starts before birth, during the pregnancy. So of course we want pregnant mamas to have, a balanced, well-diverse diet. That's kind of a given. That helps with everything. We also want mama to stay healthy, so they don't have to take antibiotics. We want to try to avoid those antibiotics at all costs, which just kind of like disrupts the balance of the good and bad bacteria in the gut. And then, once it is time to give birth, we want to try to opt for that vaginal birth versus C-section, like at all costs. That we know it brings the baby in contact with the mom's bacteria as the baby exits through the birth canal. So that directly, kickstarts the gut colonization of the baby. After birth, we want to, if we can, if possible, initiate breastfeeding as soon as possible. We know breast milk provides like the pre and the probiotics, the human milk oligosaccharides or the HMOs, which is a natural prebiotic. So that helps promote the growth of good bacteria in the gut. We also know breastfeeding supports immune function. If unable to breastfeed, we still want to initiate that skin-to-skin contact right after birth, because again, that passes back and forth the bacteria, which again is building that gut, building that immunity and colonizing the gut. And also dads can get involved with this skin-to-skin as well. So, even if we're not breastfeeding, we still want to do that skin-to-skin right after birth. And also don't worry if you can't breastfeed. Like we talked about, there's so many formulas out there on the market. Most of them nowadays do have the pre and the probiotics, the HMOs. So they've really come a long way. Yeah.
I would love to talk about this vaginal versus C-section concept, because just like breast versus formula, it is a little bit of a contrarian topic to discuss, right? Mm-hmm. Of course, there are instances where the mom has no control, myself included. With the twin birth, we had to make the option. We had to opt for C-section. And interestingly enough, doctor's office didn't really push much for vaginal birth and talk much about the microbiome and the gut health and all of the impact. So I'm very curious to learn from you, since you're an expert in that. If it is C-section, what can moms do to get back to the baby, give back to the baby, and then also get back to normal for themselves, right? With the depletion, the whole process, through the whole journey of the gut microbiome, that's important. So let's say if a mom has to go through C-section, are there tips and pointers of what she should be doing with the baby to get that stage of healthy gut microbiome back to normal for them?
Yeah, absolutely. So it is very important for, moms to have that birth plan in place. Whether it's a planned C-section, let your doctors, your nurses know that, hey, I do want to breastfeed, like this is my plan. If baby has to get taken away to the nursery, like please don't, provide a bottle. They are able to bring the baby back in and do that skin to skin contact, like right after a C-section, like still kind of on the operating table, like they can still do that. Let the nurses know that you do want to breastfeed, and therefore, they're not going to take the baby away and give them a bottle of formula. Right. So just having that plan in place can really help alleviate some of those. And then also probably like prior to that, during your pregnancy, just have those conversations with your OBGYN, and if it's not absolutely necessary or indicated to have a C-section, like see if it is possible to have that vaginal birth.
Fantastic. Well, yeah. I'm so glad to have learned all of this from you today, and I'm sure our audience feels supported as well. Any other key takeaways or learnings that we did not discuss today that Kristen you'd like to relay?
Well, I did have on here to discuss also, since we're talking about infant feeding, like some other ways to improve digestive health and gut health as we're introducing solids as well. So if it's okay if I can just touch on that for a minute or so.
I think we absolutely should. Sorry, I might have cut you off before.
No, that's perfectly okay. That's perfectly okay. Yeah, because with that, we want to make sure that it's the right time that we do start those solids. We do see a lot of moms that eagerly want to start, and we don't want it to be too late. We don't want it to be too early, and we also don't want it to be too late. So if it's too early, we might see some of that. They might not be able to digest it or break it down. So with that, we'll see more of the gas, the vomiting, the spit up if it's too early. Mm-hmm. And if it's too late, then we're missing out on that window of opportunity to introduce those early allergenic foods. We also want to introduce foods in a gradual manner, because that contributes to the development of the baby's digestive system. So don't go ahead and do 5 foods at once. We want to do 1 food every couple of days just to help with the development. As they transition, we want to offer that variety. So once they do have a food within their routine, within their regimen, just kind of build off of that. So that way we are building that diversity, which helps support growth and different bacteria in the gut. So overall contributing to a healthy and resilient digestive system. It also helps expand that variety. So when they're older, we see less of the picky eating, less of the food aversions. And then also trying to avoid that antibiotic use in infants as well. If it's not necessary, try to have that conversation with your pediatrician. And then also I just want to touch on what works for one baby might not work for everyone. So you just, a lot of things are a little bit of trial and error, unfortunately, but just knowing that, what works for one baby might not work for someone else. So it really is very individualized.
Like we say, there is no norm when it comes to normalcy as we talk about babies. With that said, thank you for all of the learnings that you shared with us today, Kristen. It was phenomenal to have you on our episode. Appreciate it.
Thank you so much for having me.
If you need further guidance, don't hesitate to reach out and download MissPoppins app, where you can connect with our team of experts, including development, sleep, lactation, and many more coaches, all dedicated to helping you master the art of parenting. I'm your host, Nicky Rishi, signing off. Thank you.